This is Dr. Heilig with Assured Orthopedics of Kentucky. I'm an orthopedic surgeon. I'm going to give you a presentation on hip arthroscopy and what to expect. Hip arthroscopy is basically making 2 to 3 small incisions, about a centimeter each, going in with a camera and evaluating the hip joint and doing any kind of repairs that need to be done. Some of the common indications for this are a tear of the labrum. The hip is a ball and socket joint. Around the socket is a cuff of tissue called the labrum that helps hold the ball in the socket. This can get torn with wear and tear or trauma. It will cause persistent pain until it's addressed. With the scope, you can go in and remove any loose pieces, or if it's a complete tear, you can repair it back down to the bone with suture anchors that basically just tack it back down. Loose body, you can have pieces that are hung between the ball and the socket of cartilage or bone or labral tissue. Chondromalacia, some people will have just fraying of the cartilage. You can go in and smooth that off, clean the joint out. Arthritis, you can have an arthroscopy if it's not significant enough to require a hip replacement, and go in and once again clean the joint out of any debris. If there is exposed bone, you can do a microfracture technique where you just make small holes that allow stem cells from the bone marrow to come in and create new cartilage. Things to know before surgery: nothing to eat or drink for about 8 hours before surgery. You should plan on not using the hip for about 6 weeks after surgery, or at least protected use. I do allow weight bearing as tolerated, typically with crutches for about the first 2 weeks, and then continued weight bearing after that. But it takes a good 6 weeks for it to kind of settle down to a point where you can get back to doing some heavier things. Good nutrition is important for wound healing. You want to have the best diet possible. High protein can help with the healing process. You want to avoid smoking for about 6 weeks before surgery up to about 3 months after surgery. And that will also help with healing and getting the best result possible. For after surgery, you want to follow your surgeon's instructions to the T to get the best possible result. There is a failure rate of about 6% after a hip scope. There has been reports of heterotopic ossification up to 44%, which is calcium deposits in the muscle and soft tissue about the hip. Wound care, there's typically a soft dressing that can be removed about 2 days after surgery that you can then wash over it with soap and water in the shower. Don't soak it underwater until the stitches come out. I typically have you back to clinic about 2 weeks after surgery for suture removal. I do give patients crutches to use after surgery. This can help with ambulation and also with pain. If this is your driving leg, you shouldn't plan on driving for at least 2 weeks after the procedure, as it will be somewhat painful, and if you had to hit the brake in an emergency, you might be in trouble. Once again, no heavy stuff, lifting, pushing, pulling for. Try and limit it for about 6 weeks after the procedure to give it a chance to heal and get the best possible result. Pain control after hip replacement is important. Hip arthroscopy is important. You can do a block if it needs it. I don't routinely do those. You can do anti-inflammatories alternating with acetaminophen. Once again, that heterotopic ossification, the anti-inflammatories will actually help prevent that. So it'll help prevent that and help with pain. I do typically give a prescription of a narcotic pain medication to take as needed for breakthrough pain. And then once again, the crutches will help with the pain. Recommend that you use those whenever you're up. Physical therapy isn't as important after a hip arthroscopy. I don't routinely send patients to formal physical therapy. You are allowed to start moving the hip very same day of surgery. as is comfortable. Hips tend to get their motion and strength back just as you use them with your daily activities. Um, Strengthening, I would hold off for about 4 to 6 weeks before you start with that. This concludes this report on hip arthroscopy. Please do not hesitate to contact me at Assured Orthopedics of Kentucky if you have any further questions. Thank you.